If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. Tune in Saturdays at 1 p.m. for the Your Body is Your Pharmacy radio show. Hear from the doctors that were among the first in the U.S. to merge the ancient wisdom of Ayurveda and natural medicines with the advances of modern medical science. Listen to pioneer doctors Virender Sodhi, Shailinder, and Anju Sodhi to keep up with some of the latest medical advances and learn from some of the true leaders of Ayurvedic medicines every Saturday from 1 to 2 p.m. with the Your Body is Your Pharmacy radio show on Desi 1250 a.m. Radio that listens to you.
Good afternoon, folks. This is Dr. Shailinder Sodhi on the show, Your Body is Your Natural Pharmacy. And I have along with me my better half, Dr. Anju Sodhi.
Hello, friends, and welcome to the Desi 1250 AM.
And we both will be presenting to you today a very important topic, which majority of people you have either known in your, immediately friendship circle or in your family. Or you probably suffer from it too. Dr. Anju, can you tell which topic we are discussing today?
We are discussing migraine headaches today.
Yeah, the migraine headaches, is one of the topic which is really affects so many people in their daily life that it becomes them make them almost debilitating, where they cannot perform their regular chores or work. And it's really, really one of the worst thing which I have seen in some of my patients, which when they have it, they almost are totally disabled.
Exactly.
And, recently when I was doing a little bit research and found it's amazing how many people suffer in the United States. It's about 1 in 10 person, one out of 10 person have a migraine headache. That's 10% of the total population which has a migraine headache. So that comes to close to 36 million Americans suffer from migraine. So, this is a more common. Do you also know that it is more common?
It's very common. I see migraine patients all the time in my practice at the clinic. And we have some successful cases too, like if people follow what they have been told. So migraine headaches could be just an independent disease, you can say, or through the different imbalances in the body, can be a symptom due to that.
And so that's what we're going to discuss, folks, today. Today's topic is a migraine headache, and you are welcome to call us at 1-844-301-1250, 1-844-301-1250. And for all my Indian followers and listeners, आप हमें हिंदी में भी कॉल कर सकते हैं, पंजाबी में भी और उर्दू में भी. तो feel free to call us at any time. हमें कॉल करने के लिए आप नंबर घुमा सकते हैं 1-844-301-1250. तो हम आपकी कॉल लेने के लिए उत्सुक रहेंगे. So meanwhile, I'm going to discuss, what are the most major symptoms of the migraine headache. So, migraine, usually if if you have seen certain of your children or kids when they're little, all of a sudden they start telling that they are having a headache. So it actually begins at the childhood, Dr. Anju, as you know, we've seen in adolescent age or in early adulthood, all of a sudden we see parents bringing their child to our clinic with a headache. And that's, which can progress through all the stages. Children, when you a little bit of with the physical examination. Main criteria for the doctors, majority of primary care physician is to make sure it's a simple headache or it's really a migraine. So we need to differentiate between the simple headaches versus migraines. So anytime the migraine headache happens, there are 4 stages which really are affecting which makes the diagnosis of migraine headache. And there is a prodromal phase, and usually majority of people who have a migraine, they also say they see some auras and headaches and postdrome, and though they may not experience all the 4 stages, but some of these stages have to have there. Yeah.
Of course, yeah. And like with my patients, when we go with the history from the children to the adults too, so we see some of these symptoms like before and after. And I suggest my patients to keep a log, like whenever it's like what time of the month they usually getting the headache.
And what might of the situation may be happening.
Yes, so that's really helpful too.
Right. And usually in the prodromal phase, the people, all the listeners need to know that it can begin even 1 or 2 days before the migraine headaches really even hit.
Yes.
And then you need to realize there has to be pre-existing reasons something is happening. So you may notice subtle changes that warn of an upcoming migraine. It could be as simple as constipation. Sometimes mood changes. I think you hear that all the time.
Yes, mood changes. The emotional effects like that. That's a big thing, and also the hormonal, and
in the mood changing, it can be depressive.
Exactly.
Or they might feel elated or euphoria type of things happen. And food cravings. I mean, don't you notice they talk about that they craved a lot of different types of food,
especially sugars and
chocolates
the salt.
And all some of the salty foods they crave for that. And then there is other thing is neck stiffness.
Yes.
And that is this has to. I mean, they say my pain starts from my neck. And that's actually prodromal sign that it may be a migraine. Though, I mean, there can be cervical issues at the neck and vertebral issue which may be leading to headache, but sometimes it is an issue with the people who are known to have a migraine, and it brings the migraine headache more strongly. And then also increase thirst or urination, and that's another prodromal. And frequent yawning. I mean, if you find that you all of a sudden yawning too much, and you're known to have a history of a headache, then there is most likely that you have a migraine.
Yeah, and if we see this as an Ayurvedic perspective, it's a vata, excess of vata. So that is triggering all those symptoms like the neck stiffness, yawning, constipation, or the bloated.
Right.
And these symptoms start because they are having excess vata in their body, and that leads to the migraine headaches.
Yeah, so this is one of the things which, like we mentioned, majority of things when we talk about vata and all that, which is the Ayurvedic dosha, we have 3 doshas, vata, pitta, kapha, but then the combination makes it about 7 different subtypes. But when it comes to the vata, it exists at 5 different levels in the body, and one of the location of the vata is a colon.
Yes.
So colon is where majority of the digestive the final digestion is taking place. So that actually is a trigger for a lot of our population, where we talk about the food or how they are digesting, if they are having a malabsorption, or sometimes people come to us, they said, doctor, I had antibiotic treatment, and all of a sudden my digestion has been screwed up, but I'm keep getting a headache.
Yes.
So that's exactly what we're talking about, is the imbalance at the gut level.
Gut level and in the vata.
And, so that is one of the things which we will be discussing in the, in our today's, is that how we can really enhance the digestive system and do maybe a detox or something, which we are specialized at our clinic, at Ayurvedic Naturopathic Medical Clinic, where we do all the panchkarmas and guide you through the proper diet and channels. So these are the certain things which we'll be discussing in this.
Yes.
So, like I said, the gut health is a major thing which we really focus on in any type of, in Ayurveda it says all the diseases begins from the gut. And, it's like such a immune responsive system which sits in the gut. I mean, whole immune system is dependent on our super health, on the health of the gut and the intestine. So, my suggestion is to anytime that when we are, trying to talk about developing a balance, that always start to balance the gut health.
Yeah, so they should be like taking the probiotics or the simple herbs like the trifle. Probiotics really helps with the gut health, and those things helps to balance the vata into the body too.
Right. So now, folks, we will be taking a quick break, and we'll be right back after the breaks, and we'll be discussing what is really aura, which happens before the migraine. So we'll be right back. Don't go away.
Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information.
Thank you, folks. And this is Dr. Shailinder Sodhi, and we are on the show Your Body is Your Natural Pharmacy. And we are discussing migraine along with my colleague, Dr. Anju Sodhi. We both practice at Ayurvedic Naturopathic Medical Clinic in Bellevue. And if you have a question, please feel free to call us at 1-844-301-1250. आप हमें हिंदी में भी कॉल कर सकते हैं. हमारे से बातचीत करने के लिए आप हमें कॉल करें 844-301-1250 पे, और हम आपके फ़ोन का जो क्वेश्चन होगा उसके जवाब अकॉर्डिंगली देंगे. तो एनीवे, बिफोर वी वेंट टू ब्रेक, वी वांटेड टू डिस्कस अबाउट द ऑरास. Auras are usually that they may occur before or during migraines, and most people experience migraines without aura. It's not always guaranteed that it will happen. So what are auras? Auras are symptoms of the nervous system, and they are usually visual disturbances. Sometimes people notice flashes of light or wavy zigzag vision. So, like they look into the far distance and they might see that there is a wavy pattern. And that's usually an indicative that you are going to have a migraine headache. So, when that start happening, some of the steps can be taken right to stop that, right, Anju?
Yes, and plus this is because this is like nervous system related, so that also indicates with the Ayurvedic point of view that there is a vata imbalance going on in that person.
Right, and sometimes auras can also be touching sensation, very sensory. They're very sensitive in that way. That means movement or motor or speech or verbal disturbances can happen.
Yes.
In this, again, that's referring to the vata disturbance. Along which is interfering the pitta part in this case. And your muscles might feel like very weak, or you may feel as though someone is touching you, even though nobody touching you, but you feel that sensation of very sensitive spots. You say, just anybody who touches my face or my back or upper shoulder or in the back of neck, I'm so sensitive that it feels like somebody's pricking me, the pin pricking type of feelings. Each of these symptoms usually begin gradually and builds up over several minutes and can last up to 20 to 60 minutes.
Yes.
So it can be long symptoms lasting. Examples of migraine include visual phenomena such as seeing various shapes, bright spots or flashes of lights, and also pins and needle sensation in arm or leg, sometimes even vision loss. And that is very rare, but it can happen. People can have a temporary vision loss, and that's affecting the neurogenic part of the brain, which affects the vision area, and we will discuss that as too. And the weakness or numbness in the face or one side of the body can happen, difficulty in speaking.
Along with the nausea and vomiting can happen too.
Right, and hearing noises or musical sounds you can hear, uncontrollable jerking or other movements. Sometimes a migraine with aura may associate with limb weakness. It's like we call hemiplegic.
Yes.
Hemiplegia, part of your arm have no, strength. You can't lift arm, or you may not able to even walk. These are rare symptoms, but they are symptoms of migraine headache. So, folks, feel free to call us at 1-844-301-1250. AM. आप हमें 844-301-1250 पे कॉल कर सकते हैं, and we are discussing about migraine headaches, and we've just discussed about the auras, which are the pre-existing signs that there may be a headache coming on your way. And I've been told that actually this is a migraine awareness month. Did you know that, Dr. Anju?
Yes.
Yes. So the people who suffer from the migraine, they really deserve all my sympathy, because it makes them totally uncomfortable with the feelings, and they usually bury themselves in the dark room and stay away from the lights and not able to perform the work they can do. And I have known few friends in my circle and patients who have really suffered from the migraine, and it becomes really very challenging for them to do even a simple work at home, and the whole family suffers. And even if there is a little ones, we find that it is becomes even very harder for the parents to see their child to go through with the this type of migraine headache.
Yeah. So, Dr. Shailinder, do you want to discuss like what treatment they should do, or how they should deal with it?
There, the one of the things which I really recommend is that when it comes to the migraine, it's not a one thing which needs to be addressed. It's a multifaceted. That means we need to focus on what really is going on in that individual's life, what may have triggered. Triggers are always there, which could be coming from, food, and it can be coming from the stresses.
A lot of, in the children I have seen in my practice, lot of additives in the food, lot of colors into the food and the cereal, and the people usually are, kids especially, are eating all those, and that triggers to the migraine headaches too, and also the genetic component.
Genetic component is always is present in some of the family history. Has to be there that there is a migraine headache either in the mother side or the father side. Most commonly, it's interesting when we are talking about genetic and all that. In the younger, as in adult, and the young kids, when they are in the very young age, it's more common in boys. But as the age they grow up, it becomes more common in the girls. And the majority of the women who suffer is like it's women who are suffering with the migraine headache, and very few are the men having.
Yeah, in that case, I really think, like with my personal experience too, with my patients, like the hormone affects a lot in the women mostly. I have seen in my practice that women complain about having headaches more when they are close to having menstruation or when they are about to have menstruation, and that estrogen plays role because there is estrogen drops at that time, and then they start having headaches.
Right. So it's like a fluctuation in estrogen seems to trigger the headaches.
Yes.
In a lot of women, I see those who are estrogen dominant also have complaints of migraine headaches. And I have seen that as much. So the best idea is to balance out
hormones.
Right.
Hormone balancing. There is the teas available too. The simple things you can do for the, if it can be secondary too, because with the menstruation too, like the for the premenopausal symptom, it can be as a premenopausal symptom. I start getting headache.
Right.
It can be migraine too.
And other thing which I notice is women with a history of migraine often reports headaches immediately before or during period.
The period. So yeah, so that's like due to the estrogen drop.
Because the estrogen drop happens. So, that's another indication that there is an imbalance.
And that's again, it's a vata imbalance too. So for that, like the dill seed tea plays major role too. They can start drinking the dill, which is available at the Indian grocery stores too.
And these are the same individual who also say they have increased tendency to develop migraines during pregnancy or menopause, like you mentioned. So you were saying the dill seed type of tea.
They can start drinking like 5 to 7 days before, as like they can start as soon like 21 days of the cycle, and then they can have until they have.
And that's a very simple home remedy.
And home remedy, plus it's great for the digestive system too. So that can be an easy remedy.
Yeah, so folks, it's just simple. So how do you make a dill seed, Dr. Anju?
So dill seed tea, you can take 1 teaspoon of the dill seed, and you can boil in 1.5 cup of water for 10 minutes in the low heat, and then you can just filter it. And if you want, you can put honey as a sweetener, or you can just enjoy as is.
Okay. So, folks, we are discussing migraine headaches, and we have a caller on the line. So, caller, go ahead. This is Dr. Shailinder Sodhi on the show, Your Body is Your Natural Pharmacy, and we're discussing migraine.
Hi, Dr. Shailinder. This is Amrita from Bellevue. Just calling. Thank you for the show. This is great information about migraine.
Thank you, Amrita. And Amrita, do you know somebody, or do you suffer with the headache or migraine?
Well, I do. And, it has been like a family history, which it came down to me, and I've been having headaches since age 12. And I'm in my 50s now, and it still continues. So my question is, why is that? It gets better, but what form of treatments do you suggest?
Yes, Amrit, the question is a very good question, and you brought a really important point, which we have already kind of brought in, like there has to be genetic composition, which in your case, it's a family history, and it started as early at age of 12, and now you're in 50s and you're still having them. So it is much more an indication of estrogenic imbalance in your case. So Amrit, one of the things which I suggest is that we need to really, really pay attention to hormonal imbalance. And also there got to be other triggers as well, which need to be looked at. The food components need to be looked at as well. So in your case, is your the headaches have gone lesser than they were when you were kind of young age, or it's existing at the same pace?
They kind of fluctuates. It it goes up and down, and certain food triggers it too. So what are some of the treatments in the clinic that you all do that can kind of help, or we can do at home?
Right. So the treatments which we do at Ayurvedic Naturopathic Medical Clinic is a Panchkarma. The Shirodhara is an excellent way to address the migraine headache. And the other thing which I work is a marma therapy. I work on the marma points, and I find a great relief in my patients. Some of the patients just coming crying, and they leave smiling. They say like, boy, the tons of loads I've taken. What else we do, Dr. Anju?
Also, I do on some of my patients with the vacuum therapy. You can say it's like a cupping with the Chinese medicine, but it's not like it's all electric, and it's like very safe and non-invasive.
And we do also, like EMS, where the sine wave treatment.
Sine wave, yes.
And also try to release the trigger point areas, the pressure areas, and the chakra points, which I usually work with my patient. Also try to release that, and working in the paranasal areas and the in between the eyebrows area where the trigger points, we call the marma points, we release those.
Yes.
And usually that helps. In your case, Amrita, I would also pay attention to the diet part. And usually there are triggers for that, like Chinese food, which contains a lot of MSG. You need to be careful with that. And then also the diet.
Maybe if like the chocolate, many of my patients it triggers with the chocolates.
Exactly, and they are very simply allergic to the chocolate part. And then there is aspartame, all those diet cokes and all that. But again, looking into your diet and paying immediately about 24 to 72 hours of the diet chart, you need to look at what you have eaten in, immediately to 3 days behind, and what might have triggered. It could be food related, it could be stress related, it could be hormone related, and as simple as if you have not slept well, which could be secondary to the stress, maybe, or sometimes environmental changes, the weather changes. So it's really, we appreciate your call, and you really brought a very good point. And thank you for calling us at Radio Desi. And we are talking on the show, Your Body is Your Natural Pharmacy. And is there another call? Okay, caller number 2. This is Dr. Shailinder Sodhi on your show, Your Body is Natural Pharmacy. What is your question?
See, my question is, I have a migraine from when I was 10-year-old. And I'm dealing with that migraine pretty much in a twice a month. Now, I was able to bear it for myself, but now my kid, who is 10-year-old, he also started getting the same behavior.
Yeah, see, that's a very strong genetic component. And usually boys are, like we mentioned, is a study, research have shown that in the younger age, it's the male. Who suffer with the migraine more often. And do you also have a migraine as an adult, or is it less common to you now?
No, I'm still having the migraine, and previously it was like thrice in a month. Now it reduces to twice in a month, but
Okay.
I get migraine.
Right. And and you mentioned your child is having. So in your case, I really, definitely there is the component, there is a weakness which is bringing up. So what we need to look into is, in your case, is what is really triggering that headache. What are those triggers? And triggers like
I'm aware of those triggers.
yeah, and just knowing, like, as simple as some of the triggers could be like eating dairy products, old cheese, salty foods, processed foods, or even sometimes people who skip a meal or who go for a fast.
So what are your triggers?
My trigger is sun.
So sunlight and
Then
Mhm.
sunlight. Then any exertion.
Okay. So, it's much more like sensory
keeping
stimulation and the physical activity, which if you overwork, it brings the headache up.
Uh-huh.
And do you find, are you really also sensitive to the strong perfumes or paint thinners or some kind of smoke or anything like that?
I don't think so. That probably is not one of the trigger points.
Yeah, because a lot of people who have a migraine, they also are very sensitive to the perfumes, strong perfumes, and paint thinners, those type of smells, which also brings it up. And other things which we need to pay into the diet part is the allergens. Just sometimes addressing the
Yeah.
dairy and other allergens.
Exactly, because you have this, these things triggers you. I will suggest you that you need to pay attention to the diet, said that like your diet is hypoallergenic. So what you can reduce is you can reduce the wheat into diet, the dairy into the diet, the peanuts if you are fond of eating peanuts, and soy products. These are maybe sometimes the eggs too. I have with these the symptoms you said, the triggers. I had in one of my patient, and then I put her on the hypoallergenic diet along with some herbs and supplements, which is that you can add a little bit more curcumin into the haldi,
Which
into
is the
the
turmeric,
diet too,
yeah.
turmeric,
Yeah.
into the diet too, and start doing some breathing exercises too. That will definitely help. The other thing, if you haven't had any blood work or something, get your vitamin D checked too. So that can be another thing.
It
we
can
pay
be as
attention
simple
to.
as fixing small things. But, in the migraine, I find there is always a trigger. And if you can look behind in 2 to 3 days behind, and you can figure that out, and avoiding that will really take care
Because
of
you mentioned that the sunlight, pay attention to your hydration too. Have some like the coconut water. So electrolytes, add some electrolytes into your diet as well.
Right. And, doing breathing, pranayam, meditational breathings, and, having a little bit of those Shitali breathing, which we call the tongue breathing. And
Yes.
those type of breathing really helps with the
Helps.
migraine. And also knowing the trigger areas, like I mentioned earlier, in the paranasal area, in between the eyebrows area, just pressing those areas can release the headache. So these are the simple techniques. But if you really have any other things, just bring, come into our clinic, and we'll be happy to help you. But as far your child goes, I will definitely pay attention very much
because
into
of
the
the
diet.
food allergies.
Right. In the child, we definitely pay. But again, hydration and developing good habits and yoga and breathing exercise, these will all help you to lessen the amount of migraine headaches. Do you have any other question?
No, I went to the neurosurgeon also.
Uh-huh.
He also was saying the same thing, that there is no permanent cure for this. You just have to look for the trigger point. I just want to know that is there any permanent cure which
Well,
can
usually
be
what
done? I'm not worried on myself.
Yeah, in my practice, I usually pay attention to the diet and the lifestyle and the triggers, and we try to minimize those. And I have been fairly successful
Same here.
and in controlling. Like I said, any time if small incidents can just bring the trigger point, and you can have a trigger headache, and which can lead to a migraine. So that's fairly common in the people who suffer with these migraines. And like we mentioned earlier, it is a very debilitating. And if you really, sometimes simple fix is as it is having a ginger tea, it can help you, and green tea can help you. and also doing meditation and sitting in the less light areas in the.
Try to find the ways so you can de-stress yourself, or the exercise will help you too.
And other things which I find in common is these days people spending too much time on the screen and on the telephones, the cell phones, and those are also the trigger, especially when you have a sensory stimuli which will bring the migraine. So trying to cut down those and taking a break in between your work will definitely help you to control your migraine headaches. And we have another phone call, and go ahead, caller, you are on the show. Your Body is Your Natural Pharmacy, and this is Dr. Shailinder Sodhi.
Hello, Doctor.
Yes, can you come closer to the phone where I can hear you?
Hello.
Hanji, boliye. Can you?
Dr. Shailinder, Dr. Anju?
Yes.
Anji.
My name is Anju.
Hanji, Sanjeev ji.
My question is that how do I know if the headache I am feeling is actually caused by migraine and not other types of headache?
Okay, that's a very good question. And, that's, again, a lot of people really need to understand simple headache versus migraine
headaches.
The simple headaches are usually which responds to the, even simple over-the-counter painkillers, and then can go away. Where the migraines are usually not that way, and they last much longer. And they can last up to 2-3 days. And there is usually prodromal phase, like they can have an aura phase. So in the headache, when you see if there is a like we mentioned earlier, either you're having a sensory issues, like your skin becomes very sensitive, or you're having a neck back pain in the areas, or double vision, or weakness in the muscle and limbs, that's usually is associated with the migraine. Where the simple headaches can just happen because of any other reasons. It could be a sinus thing, or those sinus issues can also bring the migraine headaches. But the simple headaches are usually treated with over-the-counter medication, or even with the herbal teas.
Or if even like the ginger tea, or if it's just the stress related, it usually goes away in an hour or 2 hour max. But usually the migraine headaches are much more longer. And if somebody is having the headaches like every month at certain time, it's like cyclic, like every 2 weeks or 3 weeks. Then it's much more seems like migraine headaches.
Yes. So migraines are more cyclic, Sanjeev. Rather, that means they come more often, whereas the headaches are rare occurrence.
Yes.
If somebody is walking in the, in their daily life or in the office once in a while, in a year they get 1 or 2 headaches. Whereas in the migraine headaches can, like our previous caller mentioned, he has more headaches, like 3-4 times. And, that's usually an occurrence. And they usually know the triggers which brings that headache. And that's the main difference between the simple headache versus the migraine headaches. So anyway, thank you for call, Sanjeev. And we are discussing the migraine headaches. And, the previous caller mentioned some of the triggers. One of the triggers we already mentioned is the hormonal changes. And the foods, like we mentioned, is like any cheese or salty foods, processed foods, or even fasting. I have seen that low blood sugar levels can bring the headaches, and they can trigger the headaches. And there are food additives, sometimes they add sweeteners, aspartame, and MSGs, which is monosodium glutamate, which is very present in Chinese food and some of the Asian foods. They can trigger the migraine headaches. So, knowing what you have done in 24 to 36 hours to 72 hours will definitely help you to know what your triggers are. And also sometimes alcohol, especially the wine, which have a sulfur component or sulfites, which can bring the headaches as well. So, and sometimes very highly caffeinated beverages can trigger the migraines. So these are the certain things which really are the cause of the headaches. So we will take another break, and we'll be right after the show. The show is Your Body is Your Natural Pharmacy, and we're discussing migraine headaches. And the number to call is 1-844-301-1250.
If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic, or call us at 425-453-8022. That's 425-453-8022. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022.
Okay, folks, this is Dr. Shailinder Sodhi along with Dr. Anju Sodhi, and we are discussing migraine headaches. And please feel free to call us at 1-844-301-1250, where we are discussing migraine headaches. And before the break, we were discussing the triggers. And we mentioned the alcohol could be part, and caffeinated drinks can be part of the migraine headaches. And stress at work or home can cause a migraine headache. A lot of people see some of the issues when they have work-related stress, that they have the migraine headaches, which comes up. And we also mentioned about sensory stimuli, which can be cause of a headache. And also change in sleeping and getting up the pattern. If you don't have a sound sleep and you keep on working night shift, day shift, or in between, and don't have a sleeping pattern, that can also trigger a headache.
Definitely that can. And also in some of my patients, like the oral contraceptives.
Yes.
Some women taking oral contraceptives, it can increase the headaches, and the same time, like I have also patients, they mentioned that after starting the contraceptives, it helped too. So I think that's again the estrogen.
Right. It's just a balancing of the hormones. Which you mentioned.
So it can work both ways.
Some people also say that if when they work out, they exercise or overexert themselves, that comes. So knowing your limitation, not to overwork, or if once you have a headache while working or a couple times, then you know it that you cannot really put your body through the physical exertion. So learning to relax and stretch and doing yoga, that helps too. And then also change in environmental, the weather, the barometric pressures, and the every seasonal changes.
Yes, I mentioned earlier, the excess vata related headaches, migraine headaches, that will increase when there is like the rainy weather, dry weather, cold weather. And so that can trigger. So it's better to avoid, if you are prone to, if you go in the cold, so you need to cover up your head, or try to avoid those conditions as much as possible.
Right. And, also like you mentioned, the oral contraceptives are known to be causing it. And then also the vasodilators like nitroglycerins and other types of those are known also bring the headaches. And, so knowing what is aggravating, is very important to minimize so you don't get that migraine headaches. So now, some of the risk factors are, like we mentioned, is the family history.
Yes.
There has to be strong family history, and the chances of developing in the family history and the next generation is bigger of having migraine headache. And though, we mentioned about the age, like a previous caller mentioned, the young age as 10 or 12 started. Migraines can begin at any age. Though the first often occurs during adolescence, migraines tend to peak during your 30s. And gradually become less severe and less frequent in as we grow older. So the headaches will come down as 40s and 50s. and rarely in 60s.
And I really think that people who has the problem with the headache, for their children, they need to avoid introduction of the early, the allergenic foods. Like sometimes people start giving food as early as 6 months. And that is not right.
Right, and that's a very good point, that we need not to introduce the
especially
solids in the family of where is the migraine headaches. So their children should not be introduced to the solids in very early age at 6 months. Actually, they should be waiting for 1 year or so. So we have a caller on the line. Caller, go ahead. This is Dr. Shailinder Sodhi on the show Your Body's Natural Pharmacy. What is your question?
Hi, doctor. Thanks for the show. My name is Santosh, and I started getting migraines for the past 2 years, and I managed to figure out the triggers. Is it okay there are some triggers like cheese, even small quantities will trigger headaches, but chocolate and caffeine?
Oh, yes, yes.
I want to see if I can go back and start using them in moderation? And the second question is, how long will this go on? Like, if I avoid triggers for, let's say, 5 years, will that be cured, or is it for life?
Okay. The one of the thing, Santosh, this question is, you said you recently started having migraines. And how old are you, if you don't mind telling me?
35.
Yes. So, what happened is you notice that the cheese and chocolates are your weaknesses, which actually brings the migraine headaches. And, those are known to be actually one of the causative factors for bringing up the migraine headaches. We don't know why, but could be, the presence of some of the proteins. Sometimes it's the amino acids which are present in it. Sometimes just an additives which may be present in the cheese can bring that headache. And the chocolate, if chocolate is a tricky, because what type of chocolate we are talking? Are we talking about 100% pure chocolate cacao bean versus or the chocolate which we find over the counter as a candy?
Candy over the counter, like
right. So those,
usually,
right. Yeah. Those are, there is additional things which they add to the flavorings and dairy and sometimes eggs, and all those things are allergenic. So your answer to your question is, if you are really allergic to chocolate pure, is maybe trying to eat cacao beans, the pure chocolate, and see if that brings a headache. If that brings, then you definitely don't want to do chocolate. And the other question was, would your headache will come down as you progress? The studies indicate as every decade, by age every 30 to 40 to 50 to 60, these migraine headaches tend to go down. But in your case, I will definitely pay attention, amount of stress you might have, amount of time you're spending on the computers or on the cell phones, and other things which may be as additional part. They may be small trigger, but they probably add on to additional food thing. As for the cheese and all that, the best thing maybe is to just avoid for time being. Otherwise, the migraine can keep on occurring.
You can try some other, like the goat is the hypoallergenic than the cow milk. So you may want to try the goat cheese and see if that is okay.
Right, and that could be a better alternate for you.
Better alternate, yes.
Right.
All right. Thanks a lot.
Thank you, Santosh. So anyway, there is another caller. Caller, go ahead. This is Dr. Shailinder Sodhi, and you are on the show, Your Body's Natural Pharmacy, and we're discussing migraine.
Hi, Dr. Sodhi. This is Deepak. Actually calling for my wife. She is at work, and she the schedule doesn't match, so I'm calling on her behalf. But she does get these migraines at least a couple times a month, and it's terrible when she's experiencing them. It's just her head. She feels dizzy, and I wish she was on the phone to explain better. But it's mainly the dizziness is what really it's killer experience.
Right. So Deepak, what I would probably like to know is, if her migraine or the headaches are just before periods, it's like a PMS type of thing, premenstrual syndrome we call, and if that's triggering up the migraine, or if it is around the ovulation, it definitely could have a component to the hormone, like we mentioned earlier. And the dizziness and all that's a very common thing. Sometimes we mentioned they feel very weak with the this type of headaches, that they are not even able to do very simple tasks. They feel like laying on the bed in the dark room and covering. So, again, it would be great to find out what is the hormonal status, what is the, if that there is a trigger, the foods need to be looked at again. In her case, make sure she's hydrating. What would you say, Dr. Anju?
Definitely, I will pay attention to the hormonal aspect. And if she's getting at the mid-cycle or maybe when she's having the period, starting the period, so she can start taking some supplement. It's called Regu Cycle, which is available at the super supplements too from Ayurveda. She can start taking that, like 1 capsule 3 times a day, and see if that helps her to regulate her hormones. And also, like if it's sometimes like some oils can help too, like as Dr. Shailinder discussed earlier, it could be gut-related thing too. I have some of my patients like the castor oil, 1 teaspoon of the castor oil with warm water at the bedtime.
And balancing out the gut
Balancing
health.
out the gut health with the trifle and probiotics can be very helpful too.
Right. So these people.
Well, I do know. Sorry, doctor. And I was listening in on your call earlier, and I do know for a fact, like whenever she takes alcohol, definitely, that triggers it.
Right, and the wines are the most culprit, Deepak. And there is because of the sulfites present in the wines are the triggers, and the darker the dark color wines more often than the simple
and
wines.
Plus the sugar.
And the sugar component could be part of as well. So definitely avoiding that is is better. Otherwise, I recommend, whenever these people do some of these type of things, they need to have liver supportive herbs as well as a trifle and
the
livet, which kind of helps to purge out the aldehydes formation after the alcohol, which alcohol converts to and leads to a headache. So it could be just a minor trigger, and it could be just leading from minor headache to full-blown migraine. Could be the trigger of the wine, which can lead to this type of situation. So breathing exercise, hydration, extra hydration, and by opening a window and breathing into the fresh air will definitely help with the migraine in this case. So Deepak, my suggestion is to getting a hormonal balance checked and making sure if there is a hormonal trigger, balancing that out would be good, and then looking at the diet. And definitely, like you said, the wine is a trigger in your case. So that really is one thing which I will avoid in any cost.
Yes, and plus the little bit hypoallergenic diet always helps.
Right. So thank you, Deepak, for calling. Do you have any other question?
No, just one last thing, doctor. So I'm glad you mentioned the wine because it's mainly, she doesn't do the wine. It's mainly like the vodka, the hard stuff that.
Right. It could be that too. Like I said, alcohol could be part of that too. And alcohol in any form. In some people, it's hard liquor, and wines are.
It can be.
In my practice, I've seen more people who react to the wine. So
yes.
Anyway, so it is an alcohol component, and that's what it is. Thank you, Deepak, for calling and for your question. So, folks, this is Dr. Shailinder Sodhi along with Dr. Anju Sodhi. We are doing migraine headaches on your show called Your Body is Your Natural Pharmacy. And, we mentioned about some of the triggers. Now I will let Dr. Anju discuss the treatment plans, what we do ayurvedically.
So I do want to discuss quickly, like I talked about the vata headaches, and there is also a pitta aspect too, like when there is a pitta imbalance into the body, someone can have the headache. And with those, like I have noticed, like more like if they are habit of sitting on the desk and working and have a lot of indigestion with the acid reflux. If those type of issues are present, then it's more with the pitta imbalance into the body too. So irritability, anger, those kind of symptoms can also be the part of it too. So for those patients, for the Dr. Shailinder pitta imbalance, I think the Shirodhara is great for them too. And at the Ayurvedic clinic, we do Shirodhara with the milk too, water too, oils too. So it depends on what we are looking for.
Right. And, in general, like we mentioned, is considering like a Panchkarma, which is a 5-step detox. Can you talk about a little bit about Panchkarma, Dr. Anju?
Yeah, Panchkarma, like 5 steps. First is the massage, which is it's a whole body massage. It's a marma point massage by 2 Panchkarma technicians. And so after that, it goes on it depends on the person to person, like we customize it, but it's like 5 weeks first of the twice a week for the massage part. And then right after sitting after the massage, they have to sit into the infrared sauna. Because with the massage, we try to bring the toxins into the circulation, and then sitting into the sauna helps to, with the perspiration, to bring those toxins out. And these massages,
I need to mention, these are not very simple type of technique. It's very much Ayurvedic massages. It's a very different technique. It's usually done with the
dosha-specific oils too.
Right, and these are the massages which really helps to detox you, then lymphatic drainage. And usually there is a preparatory phase which is we do before even Panchkarma begins.
That's the oleation.
Oleation is done, and oleation actually really helps to move all the toxins into and bring it to the layers, and which make it more helpful when we do massages. The abhyanga, which we call in Ayurvedic terminology, followed by the Swedan, which is infrared or steam sauna.
And then the third step is the fasting, where it's with the fasting can be, it depends on, again, it's customized from castor oil to the other oils too. And then that goes for the fasting part, they have to drink the juices and from the vegetables
so it's
and
a much
fruits.
more modified. Like I mentioned, some triggers in the migraine headaches are the fasting. So we try to keep the sugar back. We have to customize. Everybody cannot be put into the same bag. So that's the beauty of Ayurvedic treatments. That is very much individualized treatment.
Yes.
So you may have migraine, your friend or your other family migraine, but your triggers can be different, and maybe those things we need to address.
We need to customize the fasting part, and the purging is where we are drinking some laxatives from castor oil to any other oil. And the last part is the colonics to help
or the enemas or the bastis we call.
Yeah.
And that really helps to take the vata balance, and which we said
large intestine.
Right. We mentioned that the migraine headache can be vata aggravation.
Yes.
Which we try to balance out accordingly, and that really helps too. So the supplements like probiotics and
trifle, livid too.
Yeah, these are the things which really are very helpful to keeping the gut health and balance out naturally, and helping you to detox, which in the migraine case, I think I find that these are the triggers in the people who are toxic overload. The liver is not able to clean properly, and that can bring the headaches, which is fairly common.
And if you feel like there is a pitta imbalance, it goes with the acid reflux and a lot of the digestive symptoms like those, then cow ghee with warm milk is very helpful too.
So that would recommend doing it like at night or something?
At night.
Right. And that actually brings up very thing, because milk and all that actually helps to balance out the serotonin levels in the body. And usually the modern treatment are the some of the treatments are the serotonin reuptake inhibitors, which they give to increase that level, so and to block the headache. But those are the allopathic treatments which people have taken, and that helps with some small populations.
And Dr. Shailinder, like by taking a lot of painkillers too, that also imbalances they can start having the ulcers and the stomach issues too.
Right, with the Advils over the counter. And
so it's better to, with the Ayurvedic point of view, we do not treat it as a symptom, we treat it from the root, like what is the root cause for all these symptoms. And Dr. Shailinder, do you want to tell a little bit quickly about the Shirodhara too, because that's also helps a lot with the migraine patients.
The Shirodhara actually is one way to balance out the Sahasrara chakra, which is the seventh chakra over the forehead we have. And the whole idea of doing Shirodhara is it's a kind of oil dripping at the Sahasrara chakra, at the particular marma area, which stimulates it. And by balancing the Sahasrara chakra, we're also balancing out the other seven, whole body 7 chakras, and creating that energy flow within the body, which really helps in these individuals to control the the imbalance of energy and bring into the balance, which cuts down the headaches. So we know that the headaches are usually, when they're happening, it is interfering at the neurological level. So and the Shirodhara is the best way to bring that the imbalance into control. And people, when we're doing the Shirodhara, they usually fall asleep right on the table.
Yes.
And it's a wonderful treatment. It's very relaxing, very calming, and people enjoy this treatment, and it's excellent for getting the people who have a headache, to getting them back in a balance. Other things which we recommend to do is
also there's a little bit of the chiropractic work we do at the office too, when if patients suffer from the migraine headaches come.
Right, and my protocol is very simple. I look at the diet. I pay attention what is out of balance. If there is a physical manifestation, balance out the physical aspect by doing naturopathic manipulations or Ayurvedic marma therapies and treatments, and giving a little bit cold pack in the back of the neck and adjusting the neck or cervical or thoracics, and also doing a little bit of muscle relaxant techniques and the trigger point by giving sometime releasing the trigger areas. And that balances these points, and people feel excellent with the headache once they have it. So anyway, folks, if you have a migraine or a headache, please feel free to call us at 425-453-8255. 8022. Again, our clinic is 425-453-8022. And we have our practice at Ayurvedic Naturopathic Medical Clinic in Bellevue.
And a lot of insurances do. We do take a lot of insurance.
Yeah. And you can check with your insurance if they have a naturopathic coverage, and you can be seen at our clinic. And anytime somebody is having a headache or migraine, it's like I mentioned, it's a very debilitating condition which really takes away from your daily work.
And if we pay a little attention, it's treatable.
And it is a treatable, and like I said, we can cut down the amount of headaches you can have. So anyway, thanks for joining us today at the show Your Body's Natural Pharmacy, and I, along with Dr. Anju Sodhi, thank you for listening us.
Thank you.